So this is my patient Lauren. Hi Lauren.
Hello.
So I'm going to be testing your sensation. So what I want you to do is you're going to close your eyes and I'm going to be touching at different points of your body. And I just want you to tell me if the sensation feels normal to you or if it feels a little bit abnormal. Okay? So you're just going to say normal or abnormal. Okay. Sound good? Mm-hmm. Okay. Alright, so I'm going to go on the right side and do the sharp dull sensation, okay? So go ahead. Okay, so this is the myotome testing. It is the motor examination component of the Asia Impairment Scale. So there are going to be 5 key muscles to be tested in each upper extremity and then 5 key muscles to be tested in the lower extremity. So the first one is going to be the C5 myotome and it's going to be elbow flexion. Okay, so Lauren, I'm going to be testing your motor strength. So what I want you to do is I just want you to bring your hand to your nose by flexing your elbow. Okay. So now I'm going to put you in this position and I want you to hold this position. Don't let me bring your hand to the table. Okay. Okay. And then the C6 myotome is going to be wrist extension. So Lauren, what I'm going to have you do is try to bring your wrist up to the ceiling. And relax. And then I'm going to put you in this position. Try to hold this position. Don't let me put your hand to the table. Okay. The C7 myotome is going to be elbow extension. So Lauren, what I want you to do is try to straighten out your elbow and bring your hand to the ceiling. Great. And then I'm going to have you hold this position. Don't let me push your arm down. So to test the C8 myotome, which is going to be the long finger flexors, and the muscle you're specifically testing is the flexor digitorum profundus. So you're going to have the patient with the hand by the side, and you're going to have them in full supination. And what you're going to want to do is stabilize the metacarpophalangeal and the hip joints so that the distal interphalangeal joint is free to move because you're going to ask the patient to bend the tip of their middle finger. So Lauren, what I want you to do is try to bend the tip of your middle finger up to the ceiling. Okay? And so since she was not able to bend the tip of the finger against gravity, we cannot classify her as having a grade 3. So you're going to have to move into a position that is gravity eliminated. So you're going to put the forearm in neutral pronation supination, and you're just going to do the same thing. You're going to stabilize the 2 proximal joints, and then you're just going to ask the patient to bend the tip of the middle finger. So Lauren, can you bend the tip of your middle finger? Okay, and as you can tell, she was not able to bend, so we cannot grade her as being a 2 out of 5. So the next is to move to palpating for any muscle contraction. And Lauren, can I have you bend the tip of your middle finger? And I did not feel any palpable contraction, so we are going to have to give her a grade 0 for the C8 myotome. To determine the myotome for T1, you're going to be testing the abductor digit mini for the pinky abduction. So for a grade 3, you would place the patient in this position, and you're just going to ask them, Lauren, can you move your pinky away from your ring finger? And she's unable to do this against gravity, so we're going to place her in a position that's gravity eliminated, So you're going to have the arm in full pronation, and then you're just going to palpate the muscle. And I'm going to ask you again, Lauren, can you move your pinky away from your ring finger? And she's still unable to do the movement, and so we would drop down to a grade 1, and so I'm just going to be palpating for a muscle contraction. So, Lauren, move your pinky away from your ring finger. And still nothing, so she would be graded for a 0 for the T1 myotome. To test the L2 myotome, you're going to be looking at the hip flexors. For grade 3, you are going to flex the patient's knee and hip into 15 degrees of flexion and support under the distal thigh and the ankle. And then you're just going to ask the patient, Lauren, I want you to bring your knee to your chest as far as you can. All right, hold this position. Don't let me push you down. To test the L3 myotome, you're going to be looking at the knee extensor, so the quadriceps. For grade 3, you are going to place your hand underneath the knee to be tested, and then rest your hand on top of the opposite knee. And you're going to ask the patient, Lauren, can I have you straighten your leg up to the ceiling? Perfect. Hold this position. Don't let me push you down. To test the L4 myotome, you're going to be looking at the dorsiflexion of the ankle, so the tibialis anterior. To set this up for grade 3, just place your hand underneath the knee to be tested. So you put the knee in slight flexion, have the patient start with their knees, with their feet, with their toes pointed to the floor, and then you're just going to ask your patient, Lauren, can you bring your toes to the ceiling? Okay, hold that position, don't let me push your foot down. To test the L5 myotome, you're going to be looking at the long toe extensors, so the extensor hallucis longus muscle in particular. For a grade 3, you're just going to stand by the patient and you're going to ask them, Lauren, can you bring your big toe closer to your head? Perfect. Hold it there. To test the S1 myotome, you're going to be looking at the ankle plantar flexors, so the gastrocnemius and the soleus muscles. For a grade 3 setup, you're going to have the hip in 40 degrees of flexion and the knee in full flexion. You're going to have the patient start with their heel in the table and their foot in full dorsiflexion. And then you're going to instruct the patient, Lauren, can I have you push your foot into my hand and lift your heel off the table? To move on to the grade 4 and 5, to test resistance, you're going to have the knee in full extension and the foot in full plantar flexion. You're going to provide counter resistance at the back of the leg, and you're going to ask the patient, don't let me move your foot up.